everyone, welcome to our sharing session today. My name is Cheryl. I'm an audiologist from 20dB Hearing. I'm your host for today's sharing session. Please feel free to share this session to your family and friends. Do remember to like and follow 20dB Hearing Facebook page for more updates. On this wonderful day, we are now having a sharing session on Is ear candling safe? I believe all of us are excited to know more about it. If you have any questions, feel free to leave a comment in the comment box and we will answer your question in the comment box later on. We are honored today to have Dr. Sien Hui, ENT Specialist, Head and Neck Surgeon from with us today. Let us watch a simple video of Dr. Tan.
In 2009, Dr. Sien Hui completed her medical degree from St. George's University of London on a full scholarship awarded by the Malaysian government, JPA. In 2013, she obtained a diploma of otolaryngology, head and neck surgery (DOHNS) from the Royal College of Physicians and Surgeons of Glasgow. Following postgraduate training in otorhinolaryngology in University Malaya, she successfully attained her Master of Otorhinolaryngology Head and Neck Surgery. She is also a member of the Royal College of Surgeons in Ireland. Besides that, she has published in multiple peer-reviewed journals and co-authored book chapters in her field.
Without any further delay, let us invite our speaker of the day, Dr. Sien Hui. Hi, Dr. Tan.
Hi, Cheryl. Thank you for inviting me to your show tonight.
Yeah, we are so happy to have you on board today. Thank you for being so supportive in our sharing session. And we know that Dr. Tan is very dedicated in delivering professional ear care services to the public, and she always emphasizes the importance of ear health. Well, today, we would like to share with our audience on ear candling. Shall we get started now, Dr. Tan?
Yes, of course, Cheryl. Okay, so what is ear candling? I'm sure everyone wants to know more about this. So ear candles are actually hollow cones, typically 10 inches long and covered in paraffin wax, beeswax, or a mix of the two. They may contain ingredients such as rosemary, sage chamomile, honey, and also essential oils. So, how is ear candling being advertised? People believe as the candle burns, it creates a low-level suction that pulls wax and other impurities out of your ear. Some also claim that heat from the candle melts and softens the earwax, which will then fall out over the next few days. So how do we do ear candling? Usually the practitioner will have you lie down and one ear will be facing up. Then the pointed end of the candle will be inserted into your ear and the open end will be lit, letting it burn for 15 minutes. Then the procedure is repeated for the other ear. And that's how it's done.
Thank you, Dr. Tan, for your explanation. It seems like it is marketed as an easy at-home solution for people with earwax built up. We do encounter patients, we always stock up ear candles at home and always do it for themselves, their children, and their grandchildren. They claim that ear candling can remove the earwax. But Dr. Tan, is ear candling safe? What are the consequences of ear candling may cause to adults and children? Have you also encountered any patient with injuries after their ear candling session? Dr. Tan?
Okay, thank you, Cheryl. Well, the short answer is no. Ear candling is not safe. According to the American Academy of Audiology, there is no scientific evidence that ear candling pulls out debris from the ear canal. In fact, scientific measurements of the ear canals before and after candling show no reduction in earwax. Several studies have been done, and all of them bring the same conclusion, that ear candling has no proven benefits. In fact, researchers even found an increase in wax because of the wax deposited by the candles. So we want to know more about the facts. If earwax, especially if it's hard and firmly pressed together, is sticky. You would need a strong suction to pull it out. Studies have shown that ear candles do not produce any negative pressure, meaning there is no suction. The temperatures produced by the candle were also way below body temperature, so it's far too low to melt any earwax at all. So the US Food and Drug Administration, FDA, has found that there is no valid scientific evidence supporting the effectiveness of ear candling. Ear candling is in fact ineffective and risky. So what are the consequences of ear candling? You can have burns to the face or outer ear. You can have candle wax falling into the ear. Sometimes the ear canal can also have more blockage with the wax. You can have bleeding, secondary infection, and earwax buildup can actually be even worse after you do ear candling. The more dangerous side effects of ear candling will be damage or perforation to the eardrum, and you can even suffer hearing loss, sometimes temporary, sometimes permanent. How about for children and babies? Well, they are actually at an increased risk of injuries and complications from ear candles. Why is this so? Children tend to move around during the procedure, which can allow hot wax or ash to fall outside the protection of the covering. So I'm sure many of you want to know if I've had any encounters. Well, I've had patients who claim to have tried ear candling first to remove the earwax, and upon failing to do so, they came to me for removal. Unfortunately, there were also a few who suffered impacted earwax and perforated eardrums after ear candling. So, in my opinion, at its best, ear candling is an ineffective way to remove earwax. At its worst, it can cause serious harm to your ear.
Thank you, Dr. Tan, for sharing with us her personal experience. It sounds really bad in having ear candling, especially it may hurt our eardrum and perforate our eardrum. Dr. Tan, would you mind sharing with us on what are the safe alternative earwax removal methods and what is earwax?
Yes, of course, Cheryl. So I'm sure there are many of you who want to remove the earwax. It's actually not necessary, but if you would like to do so, you can use earwax softening drops. You can use mineral oil, baby oil, glycerin, or you can go to the pharmacy to buy drops such as Celuvax or Ceramel. Sometimes you can also use sodium bicarbonate ear drops. So you lie on your side, and then you put a few drops in your ear and let it rest for a while. These these drops will soften the earwax. Then you repeat on the other side. Eventually, after a few days, the earwax may come out on its own. Alternatively, you can also seek professional help to remove your earwax. One of the methods would be irrigation of the ear canal. The GPs will flush your ear with warm water using a syringe. You can also see an ENT specialist for this. We will usually use a suction or a curette to remove the earwax, and this is all done under direct visualization, where you use a microscope or an endoscope, so it is very safe. So, what is earwax actually? Some of us may find earwax disgusting, but earwax is actually secreted by the glands in the skin that lines the outer half of our ear canals. Earwax is actually beneficial for us. It traps dust and foreign particles that could damage deeper structures. Earwax has both lubricating and antibacterial properties. So now we all want to know, how do we or parents know when to clean our earwax? To clean or not to clean? Earwax can actually build up in the ear canal, and this most often occurs when a person has been digging their finger into the ear and actually pushing the wax deeper into the canal. Anything a person puts in the ear, ranging from cotton swabs to paper clips, can contribute to earwax buildup. So, do you know that earwax should actually be left alone if it's not causing any symptoms and it's not preventing your pediatrician from examining the child's ear? To be honest, the earwax can actually come out on its own, especially if you're chewing, you're talking, or you're swallowing. So there's actually no need to clean most of the time. But if you do plan to clean your ears or your child's ears, use a soft washcloth to wipe away the wax that has made its way to the very outer part of the ear, but only at the outer part. Do not remove anything that's inside the ear canal. Okay, so how do we know when to clean our earwax, when it is time to see the doctor? You may experience symptoms of hearing loss, ringing in the ears, ear pain, a sensation of fullness in your ear canal, itchiness in the ear canal, discharge, cough, dizziness, or even a smell from your ear canal. So this is when you need to seek professional help. As for children, how do we know? Because they can't always tell you, right? You should take note when you notice your child sticking their finger or other objects in their ear out of irritation.
Thank you, Dr. Tan, for letting us know that earwax should be left alone if it is not causing symptoms. We know that you are with UN for a couple of years and used to work closely with audiologists. We wanted to know, Dr. Tan, do you also encounter some patients? They always thought that they cannot hear is because of earwax buildup, and they come for earwax removal. After earwax removal, they still can't gain their hearing back and still complain of hearing difficulty. So usually what would be your advice to those who have hearing problem and still hesitating to look for treatment, and how ENT specialists can help?
Okay, thank you, Cheryl. So, actually, my advice is what I actually mentioned earlier. Our ears will naturally self-clean, but some people do produce too much earwax. However, excess wax doesn't always mean that it will lead to blockage. In fact, as I mentioned, the most common cause of earwax blockage is trying to remove it yourself at home. And for those of you who frequently use earphones, they are also more likely to have wax buildup. They can actually prevent the earwax from coming out of the ear canals, and this will cause blockage. So, as I mentioned earlier, do not clean your ears by sticking anything in the ear canal. This is very important. And I especially do not recommend cotton buds because you will actually tend to push the earwax further into the ear canal, and this may cause other issues. I'm stating this again because I know many Malaysians love to do this. In fact, the safest way to manage excess wax buildup is to have it cleared by an ENT specialist. So you may want to ask, how can an ENT specialist help? Well, if you think that your ear is persistently troubling you, is bleeding or having a discharge, I would advise you need to seek medical treatment. It is important that we rule out other conditions that may cause symptoms of earwax buildup. Meaning it may not just be purely earwax buildup, there may be other things that may actually cause the earwax buildup and that may be hiding behind the earwax. So you actually do need to seek a doctor for this. So what can we do if you see us? We will perform a proper ear examination using an endoscope or microscope to see clearly in your ear. We will carefully remove the wax under direct visualization so as not to injure any structure in your ear. So although earwax removal can be a simple procedure, if done wrong, can have serious consequences to one's hearing. It is important to follow our instructions for aftercare carefully as well. If you still have persistent hearing problem after earwax removal, this is where the audiologist comes in. So how can an audiologist help? Actually, most of the time after removal, most people do well and hearing often returns to normal immediately. However, some still cannot hear after earwax removal and have hearing difficulties. This may be due to a number of causes, maybe due to old age or other things like that. Remember, hearing loss is one of the world's most common health problems. If you had your teeth checked, eyes checked, you need to get your hearing checked as well. So, yes, back to you, Cheryl, where this is where you come in.
Yes, we work very closely with ENT specialists, especially dealing with ear and hearing cases. Both professions play important role in managing hearing loss. And not to forget, in 20DB, we have more than 50 experienced audiologists nationwide, and we are the only hearing care center with ISO certified. If you are still hesitating, don't be afraid to consult us. We also provide free online video consultation prior to our hearing test appointment to understand your hearing needs and your hearing concerns. Let's get our hearing check today. With that, we have come to the end of our session, and your questions will be answered in the comments box later. We are so happy to have Dr. Tan, and we let audience know that where to seek help when they have issues Dr. Tan mentioned earlier on. Thank you, Dr. Tan, for your interesting sharing today. We learned a lot from you. We shall see all of you in our next sharing session. Special thanks to Dr. Tan. See you.
Bye.